Hey everyone, it's Harry, your host. So flu cases are rising across the United States again, and this season is not slowing down. Millions have already been sick. Hospitalizations are climbing, and children are being hit harder than we've seen in years. If you assume it's just a mild winter bug and ignore the warning signs, you could miss early treatment that lowers your risk of serious complications. And here's the important part. This season includes a new H3N2 variant that spreads faster. And while vaccines still help reduce severe illness, many people remain unprotected. So one update can protect you. Before we go further, I'm curious. Have you noticed more people around you getting sick lately? At work, at school, and your family? Let me know in the comments. So here's what's going on. The winter of 2025 and 2026 is shaping up to be one of the most intense flu seasons in over a decade. After a big wave in December that filled up emergency rooms across the country, cases slowed down a bit and people thought maybe the worst was over. But then in late January and early February, cases started rising again, especially among children. The Centers for Disease Control and Prevention, the CDC, reported that by the end of January, there were at least 22 million illnesses linked to the flu this season, about 280,000 hospitalizations, and around 12,000 deaths so far. And remember, flu season can stretch into the spring, so we're not done yet. Now, you might be thinking, okay, but isn't the flu something we deal with every year? Yes, but this year there's a twist. The main driver has been a version of influenza type A, specifically H3N2, and within that, a subclade known as K. I know that sounds technical, but here's what it really means. It's not a brand new virus. It's more like a remix of a familiar one. It has several mutations that make it spread more easily and slip past some of the protection people build up from past infections or vaccines. Doctors have said it's not necessarily more severe for each individual person, but when something spreads faster, more people get sick at the same time, and that's where the strain comes in. Hospitals, families, and schools feel it. And here's where it gets especially concerning. Children have been at the center of this season. Infection rates are highest among kids ages 0 to 4, followed by school-age children and teenagers. Pediatric hospitalizations have reached their highest levels in more than 10 years. By early February, 60 children had died from flu-related causes, and according to the CDC, about 90% of those children were not vaccinated. That's a hard number to sit with. Not because the vaccine is perfect, it's not, but because it may have given some of those children a better chance. You see, adults often have something called immune memory. Over decades, we're exposed to different strains of flu, and our bodies build up a kind of layer defense. It's not perfect protection, but it's something. Young children don't have that yet. Their immune systems are still learning. Now, I know there's been a lot of vaccine fatigue in recent years. People are tired, some are skeptical, some feel like the messaging keeps changing. And this year, there was another issue, a mismatch. The flu virus mutated after the vaccine was designed. So naturally, people ask, does the shot even work? And here's the honest answer. It may not prevent every mild infection. You might still get sick, but the data shows it still reduces the risk of severe illness, hospitalization, and death. Doctors have been clear about that. It's less about avoiding a runny nose and more about avoiding the ICU. And guess what? Flu season isn't just about influenza type. A influenza B is starting to rise now, and that strain typically peaks later in the season. So even if we're past the December surge, there's still risk ahead. As of early February, around 134 million flu vaccine doses have been distributed across the country. That sounds like a lot, but with a population over 330 million, that also means many people remain unvaccinated. So what does this mean for you? Well, first, awareness matters. If you start feeling symptoms like fever, body aches, fatigue, cough, don't brush it off as just a cold. Especially if you or someone in your household is high risk, older adults, young kids, pregnant women, and people with chronic conditions like heart disease or diabetes face higher risks of complications. And there are antiviral medications available. Tamiflu, Bloxav. These treatments can reduce the severity and duration of illness if started within 48 hours of symptoms. Timing really matters here. Waiting too long reduces their effectiveness. Another thing to consider is the ripple effect of flu infections. For older adults, flu can increase the risk of heart attacks and strokes in the weeks after infection. That part doesn't always get talked about enough. It's not just about the fever. It's about how your whole body responds to the stress of infection. And on top of that, long-term care facilities have seen elevated hospitalization rates this season. While some regions are starting to see a decline, others, like parts of the Pacific Northwest, are still reporting higher numbers. Now, from a policy perspective, federal health agencies have focused on early detection and transparency rather than mandates. President Donald Trump's administration has emphasized making vaccines and antivirals available, improving real-time surveillance, and encouraging voluntary protection measures. The idea is to give people information and access and let them make informed decisions. Critics argue that vaccine messaging hasn't been strong enough, especially with rising pediatric severity. Others say public trust has been weakened by years of shifting guidance. And you know what? Those concerns are real. Trust takes time to rebuild. But here's what hasn't changed. The flu virus evolves every year. It's constantly shifting like a river carving a new path. Some years are lighter. Some years hit harder. This one has been harder. So then what can you actually do? Let's keep it simple. If you haven't been vaccinated and you're in a high-risk group, talk to your doctor. It's not too late in the season. Wash your hands regularly. Avoid close contact when someone is clearly sick. And if you do get symptoms, seek care early, especially if you're high risk. Also, check in on elderly family members. And on young kids, ask them how they're feeling. Sometimes it's the small check-ins that catch problems early. You know what's interesting? Every few years, we get reminded that the flu is not just a routine inconvenience. It's a serious public health challenge that demands attention. And yet, because it's familiar, we tend to underestimate it. We think, oh, it's just the flu until it's not. I've had seasons where I skipped the shot and didn't think much of it. And then I had a year where I got the flu and it knocked me out for over a week. Fever, chills, exhaustion. I couldn't work, couldn't focus. And I remember thinking, this is not mild. That experience changed how I approached it. If you've been noticing more coughs around you, more absences at school or work, you're not imagining it. The numbers support that reality, but the numbers also tell us that prevention and early treatment make a difference. So yeah, take the season seriously, but don't panic, be informed, be proactive, stay safe, stay aware. And I'll see you next time. And don't forget to subscribe my channel or the latest news.